Good evening, wherever you are. This is Alina Park from ConferenceHype. From the July 2025 edition of JCO Oncology Practice, this journal review looks at teaching communication skills and developing comfort with difficult conversations, a combined palliative care oncology simulation session for hematology-oncology fellows. Background: ASCO strongly endorses the integration of palliative care to improve outcomes and support patients in their cancer trajectories. Methods: we designed and piloted a didactic simulation session for each fellowship class, led by a faculty member who is dual board certified in medical oncology and hospice palliative medicine. Results: in year 1, 16 of 21 fellows completed pre- and post-sim surveys. Discussion: tools. From the August 2025 edition of JCO Oncology Practice, this journal review looks at daily patient-reported symptoms as predictors of unplanned healthcare encounters during chemotherapy longitudinal observational study. Background: chemotherapy can cause symptoms that impair quality of life and lead to unplanned healthcare encounters, such as emergency department visits and inpatient admissions. Methods: we recruited patients receiving cytotoxic chemotherapy for solid tumors into our 90-day study. Results: on days with moderate to severe symptom levels, the odds of having one or more UHE within 7 days were 4.53 times higher for vomiting, 2.84 times higher for decreased appetite, 2.5 times higher for shortness of breath, 1.76 times higher for diarrhea, 1.65 times higher for fatigue, and 1.58 times higher for pain relative to days with no to mild levels of that symptom. Discussion: specific daily symptoms were associated with increased risk of subsequent UHE during chemotherapy. From the September 2025 edition of JCO Oncology Practice, this journal review looks at defining the rates of cytokine release syndrome associated with talquetamab step-up doses. Background: talquetamab is a G protein-coupled receptor class C group 5-member D T-cell engaging antibody, approved for relapsed refractory multiple myeloma. Methods: patients with RRMM who completed the talquetamab once a week or once every 2 weeks step-up dosing schedule between September 2023 and November 2024 were identified via the institutional database. Results: 50 patients completed the talquetamab step-up dosing phase during the study period. CRS occurred at a rate of 80%. Discussion: our findings suggested that the 4th talquetamab dose could be administered in outpatient settings given its high tolerability. From the September 2025 edition of JCO Oncology Practice, this journal review looks at survival after fertility-sparing surgery for early-stage cervical cancer compared with non-sparing surgery, a nationwide comparative study. Background: the oncologic safety of fertility-sparing surgery in young women with early-stage cervical cancer is largely based on retrospective data from small series, highlighting the need for larger studies to validate its safety. Methods: we performed a nationwide retrospective matched cohort study of all patients, age 18-45 years, with Fédération Internationale de Gynecologie, et d'Obstétrique 2018 stage, IA1 to IB2 cervical cancer, who underwent fertility-sparing surgery, FSS, cone biopsy, large loop excision of the transformation zone, or tricholectomy, between 2000 and 2022 in the Netherlands. Results: in total, 1,446 patients were included, 482 treated with FSS, and 964 with a hysterectomy. 57.5% had stage 1A1 or 1A2, and 42.5% had IB1 or IB2 cervical cancer. Discussion: women treated with FSS had a significantly higher recurrence rate than patients who had the uterus completely removed. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
From the August 2025 edition of JCO Oncology Practice, this journal review looks at racial and ethnic disparities in receipt of guideline-concordant pancreatic cancer care among older adults in the United States. Background: patients racialized as Black experience a higher mortality from pancreatic cancer. Methods: patients 65 years and older with incident PC racialized as non-Hispanic white or racialized as NH Black or of Hispanic ethnicity were identified in the SEER Medicare database from 2004 to 2019. Results of 12,772 patients included 85.5% of patients racialized as NH white, 7.8% of patients racialized as NH Black, and 6.8% of patients were of Hispanic ethnicity. Discussion: approximately half of an insured population with PC receives GCC, highlighting a need to improve multidisciplinary access and treatment. From the July 2025 edition of JCO Oncology Practice, this journal review looks at unmet social needs among cancer survivors who were concomitant caregivers, a cross-sectional analysis of the Health Information National Trends Survey. Background: this study aimed to examine the impact of social determinants of health barriers, including food, housing, and transportation insecurities, on cancer survivors who also serve as caregivers, compared with cancer survivors only, caregivers only, and the general population. Methods: data were obtained from the 2022 National Cancer Institute Health Information National Trends Survey, which collected information on SDOH outcomes, including food, housing, and transportation insecurities, as well as participants' comfort level in sharing their SDOH concerns with providers. Results: overall, 49.1% of dual roles reported facing at least one form of food, housing, or transportation insecurities. Discussion: our study highlights the significant unmet needs of cancer survivors who also serve as caregivers, as they face higher levels of SDOH barriers than both the general population and cancer survivors only. From the December 2025 edition of JCO Oncology Practice, this is a review covering timing of immunotherapy in practice, feasibility and impact of morning checkpoint inhibitor administration. Immune checkpoint inhibitors are a core mainstay of cancer care. In routine practice, the time of day of administration of ICIs invariably is not stipulated in the clinical notes. Thus, treatment timing of administration is mainly dictated by constraints related to the organization and planning of the outpatient infusion centers, the clinical pharmacy, which reconstitutes the parenteral drugs, and the patients themselves. This is a good review on the topic, well worth reading in full in this issue of JCO Oncology Practice. From the February 2024 edition of JCO Oncology Practice, this journal review looks at impact of premedication de-escalation on incidence of infusion-related reactions with daratumumab. Background: daratumumab is an anti-CD38 monoclonal antibody used to treat multiple myeloma and light chain amyloidosis. Methods: a retrospective chart review at the Mayo Clinic reviewed eligible patients with multiple myeloma or amyloid light chain amyloidosis who received their first dose of daratumumab within the 4 months preceding the date of implementation, or no more than 4 months after the date of implementation on April 13, 2022. Results: nearly all patients received daratumumab by SC route of administration. Discussion: omission of premedications after cycle 1 of daratumumab did not increase the incidence of infusion. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X. This is ConferenceHype. Stay with us, coverage continues. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the September 2025 edition of JCO Oncology Practice, this journal review looks at staff perspectives on normalizing and sustaining electronic patient-reported outcomes monitoring at 6 U.S. health systems. Background: we assess the perspectives of staff from 6 health systems to understand how electronic symptom management, an ECM program that supports patients during chemotherapy and after surgery, is normalized and sustained. Methods: starting in 2019, we integrated ECM into routine clinical practice and assessed its effectiveness using a cluster randomized stepped wedge trial results. Of the 211 staff who initiated the survey, 169 completed it. Discussion: clinical staff reported moderate levels of normalization and capacity for sustainability. From the August 2025 edition of JCO Oncology Practice, this journal review looks at role of a designated pharmacist in reducing adverse drug reaction rates and preventing potential medication errors in hematology oncology, a randomized controlled trial. Background: evidence is insufficient regarding pharmacists' impact on reducing adverse drug reactions in oncology. Methods: this single-center randomized clinical trial was conducted at its outpatient hematology oncology clinics from July 2020 to October 2022. Results: the study included 182 patients, 91 in each group. Discussion: integrating an oncology pharmacist into hematology oncology clinics reduces ADRs and improves the detection and prevention of potentially serious MEs.
This is ConferenceHype. Stay with us, coverage continues. This is ConferenceHype.
Stay with us, coverage continues.